If your cat is straining in the litter box and nothing's coming out, don't wait and see. That struggle might seem like a minor issue, but it could be a life-threatening emergency. When cats can't pee, it's not just uncomfortable, it's dangerous. We're talking about urinary tract blockages, one of the most urgent medical conditions a cat can face. It can come on suddenly, progress rapidly, and without quick action, the outcome can be devastating. In this video, we'll break down everything you need to know to recognize, treat, and prevent this condition. Because when it comes to urinary blockages, knowledge truly can save a life. As the bladder becomes more distended, your cat feels increasing pain and pressure, but that's only the beginning. The real danger comes when waste products like urea and potassium start backing up into the bloodstream. This toxic overload can shut down the kidneys, disrupt heart rhythms, and even rupture the bladder if left untreated. In many cases, this entire process unfolds in just a day or two. That's why a blocked cat isn't a wait-and-see situation. It's a drop everything and call the vet emergency. What exactly is a urinary blockage? It's a serious issue, especially for male cats. Also known as urethral obstruction happens when male cats' urethras are narrow, so even the smallest clump of crystals or a bit of swelling can block the flow. In a healthy cat, urine flows smoothly from kidneys to bladder and exits through the urethra. But when blocked, the bladder fills, pressure builds, and things begin to spiral quickly. The body can't expel waste, and it gets dangerous fast. What makes this condition so dangerous is how quickly it escalates. So, how do you know if your cat is blocked? The signs can be subtle at first, and that's part of the problem. You might notice your cat visiting the litter box frequently, but producing little to no urine. They might cry out when they try to go, or lick obsessively at their genitals. Some cats start peeing outside the box out of frustration or confusion. Others simply seem off, tired, nauseous, or uninterested in food. The tricky part is that these symptoms can mimic other urinary issues, like infections. But in male cats especially, a blockage should always be your first concern until a vet rules it out. If you're unsure whether your cat is truly blocked or just uncomfortable, there's a quick way to get a better idea. Try placing your cat in a small room with a clean litter box, no distractions, and wait for a couple of hours. If your cat repeatedly tries to urinate, but there's still no pee in the box, that's a red flag. Don't wait overnight or search for answers online. Call your vet immediately. The earlier you act, the easier and safer it is to treat. Once you arrive at the clinic, your vet will gently feel your cat's abdomen. A blocked bladder feels firm and swollen, sometimes as hard as a baseball. It's incredibly painful and confirms the need for immediate intervention. To understand the full picture, your vet may run blood work to check kidney function, a urinalysis to look for crystals or infection, and possibly imaging like X-rays or ultrasound. These tests help identify what's causing the blockage and how much damage has occurred. Time is critical, but so is accuracy. Your cat's life depends on both. Trust your vet to guide you through this urgent situation. Your quick action and their expertise can make all the difference. Treatment for a urinary blockage starts with relieving the pressure. First, the vet will sedate your cat to relieve the pressure. A catheter is inserted into the urethra to drain the bladder. As the bladder empties, intravenous fluids flush out toxins. Pain meds and stabilizers help the cat's heart and kidneys recover from shock. The next few days are critical, with close monitoring in the hospital for 3-5 days, where a cat will be closely monitored to ensure the kidneys are functioning and that urine flow remains clear. Your cat's health is the priority, and expert care makes all the difference. Discharge day is a huge relief, But it's not the end of the story. Your cat comes home with a detailed care plan, so stay vigilant. A special urinary diet is usually the first step. These foods reduce crystal formation and maintain bladder health. Your vet may prescribe medications for inflammation or anxiety. Hydration is key. Wet food, pet fountains, or adding water to meals. Keep urine dilute and flowing freely to prevent future episodes. Once a cat has had a urinary blockage, they're more likely to develop another. That's why prevention is such a key part of long-term care. Prescription diets like Hill's CD or Royal Canin SO are designed to dissolve crystals and keep the urinary environment stable. You might also consider supplements like Methagel, a gel that helps maintain a more acidic urine pH, making it harder for crystals to form. Encouraging your cat to drink more water is one of the most powerful things you can do. And while cats aren't always the best drinkers, a little creativity, like using fountains or flavoring water, can make a big difference. A urinary blockage is one of the scariest things a cat can go through, but it's also one of the most treatable if caught in time. If your cat is straining, not peeing, or acting off, don't wait. Trust your instincts and call your vet. Even if it turns out to be nothing, you'll never regret acting fast. Your cat depends on you to recognize the signs and take action. And sometimes that quick decision is the only thing standing between life and loss. So stay alert, stay informed, and give your cat the healthy, happy life they deserve. If you enjoyed this video, don't forget to hit that subscribe button, give it a thumbs up, and share it with someone who might love it too. Got thoughts, questions, or just want to say hi? Drop a comment below. I'd love to hear from you.